Let's get you updates coming in from another part of the country. This is in the state of Kerala here. After a Kasaragod negligence case now, this is another case for violating quarantine rules that has come to light. This has come in a case registered in Palakad in the state of Kerala. The accused person here is a 51-year-old man. He has a travel history of having come in from Dubai on the 13th of March. The symptoms that came in from the health officials, the man who traveled to Malappuram twice there, even attended Friday prayers, violating all the rules here of the quarantine. We have with us our correspondent Vivek getting us further inputs here now regarding this person who has tested positive as well.
That's right. This particular person has been tested positive yesterday. And remember, this 51-year-old had come to Palakad, that is, just go down in the Karipur International Airport on the 13th of March, and then he had traveled to his hometown in Palakad. He has attended two Juma prayers. He has, he has had 19 primary contacts, with his family. All of them belonging to his family. He has traveled to Malappuram. And also, what is more shocking is that son is a KSRTC conductor, who was one of the primary contacts. And this particular person was on duty on the 17th, 18th, and 19th of March, which means that whoever people, which are the who are the people who has traveled along with him in that in the particular bus, in the KSRTC bus from Palakad to Thiruvananthapuram and then to Coimbatore. All of these people are now vulnerable to this virus. So that so what the health department and the police right now is trying to contact all these people and making sure that all of these people have gone to the isolation or been moved to quarantine. This is going to be a very tedious and challenging task, because this is the second such case after the Kasaragod case on the 11th of March. Even that person has associated with at least 700 to 750 people. But now that his passports has been seized, he is right now in isolation ward. This particular person, this is another serious case of clearly violating the quarantine rules, which has been put out by the health officials. The health officials has made it very clear that all of those people who are coming from Middle East, especially Dubai, Abu Dhabi, are supposed to go to the isolation wards. Then and the moment they land here in Kerala, they're supposed to go there and receive the treatment. But this particular person somehow managed to escape the screening. Either he was not screened properly, or either he managed to escape the screening. Those things has to be investigated by the police right now. But a case is being charged against him by the police for clearly violating the rules. By all probability, that his passport will be revoked, and also the cops are trying to investigate as whether this person was apart from the route map which is already released, for it shows that at least he has traveled to 5 to 6 places, met several people. Was what is more shocking is that he has attended
Yes.
two Juma prayers, Friday prayers, where there are a large number of people who are observing prayers along with him. All of these people will have to be moved to the quarantine or the violation, isolation wards. This is something really worrying for the government, because this particular contagious disease is very viral. It can spread through droplets. So there are all chances that this could have spread to those people who were around him, especially in the prayers, in the functions which he has attended, and also while he was staying home. Now, this is going to be a huge challenge. By today evening,
Right.
also the 7th.
Vivek, this is going to be a massive contact tracing given the duration of time that we're looking at. But so far, what is known? How many people have been identified in all these days that this patient was in touch with?
What we understand from the sources from Palakad is that more than half of the people, at least 70% of the people whom he was in touch with, he was in contact with, has been identified and sent to the quarantine, home quarantine, and all the primary and the secondary contacts has been moved to isolation wards. Is now what the police is trying to do is that with the help of the KSRTC, that's the Kerala State Transport Corporation, they're trying to understand who are those people who were in the bus while he was in duty on the 17th, 18th, and 19th. Because a conductor who was traveling in a bus, especially in a KSRTC bus, in a closed KSRTC AC bus, that there are all chances that he could have touched the person while he was sneezing. There are chances that the droplets could have, touched the droplets. There would have droplets that have fell on the passengers. So all these things has to be taken into consideration. They're trying to understand who are those people who were traveling in the KSRTC bus, and also because his son was a person who was who was a conductor. Because if at all the son has been contacted with coronavirus, there are chances that that would have spread to the passengers who are traveling in the bus also. So all these
All
permutations,
right.
combinations, all these things are being checked right now, and it is going to be a huge challenge for the health officials and the police to make sure that all of these people, the primary, secondary, and the other contacts, is being brought under home
Absolutely.
quarantine.
This is irresponsible behavior here. This needs to be sent out as a very strong message to all of those who've been asked to who've been asked to remain in home quarantine. In a few days, if you eventually test positive, you've not only put your family in jeopardy by not respecting the guidelines of the quarantine, but your entire community that you would have been in touch with. In this particular case, as our correspondent Vivek is explaining, it's a contact tracing which is currently on, and it's a Herculean task because this was a person for close to 2 weeks here violating the quarantine there. Vivek, thank you for getting us those inputs.